Dr. George Kapalka, Training Director at Alliant International University in San Francisco. You were recently elected the President-elect of New Mexico State Psychological Association. And we would love to hear from you, and you talked to me about how exciting it is that you're being supported not only by the State Psychological Association in New Mexico, which is an offshoot of the state of the Clinical Psychologists Psychological Association, but you are supported by both the New Mexico Psychological Association and the State Psychological Association of New Mexico. So take it away, George. Thank you for being here.
Thank you, Dr. Ron Reimer. I will be very brief. Thank you for inviting me. Just want to present a couple of updates about New Mexico. So just briefly, New Mexico was the first state which enacted RXP in 2002, but it actually took until 2005 for the first psychologists to start to write prescriptions. So we celebrated 20th anniversary of actually writing prescriptions this year in 2025. And in the 20 years, we have evolved really quite a bit into the sort of independent profession, of course, collaborating with physicians, not necessarily medical doctors, but nurses and primary care professionals. But an important milestone we achieved this year was part of our effort actually for the past few years, which is to be able to able to supervise our own RXP students. So earlier this year in April, the New Mexico Governor Grisham signed into law a bill that allows prescribing psychologists with at least 4 years of experience to now be supervisors for practica, both for the 100 for the 80-hour physical assessment practicum as well as the 100 400 practicum. Previously, about 2 years ago, we had already passed a bill that allowed us to be supervisors for the conditional period. So right now, we're the only state where prescribing psychologists can now supervise their own in every step of the RXP training. That is the 80-hour physical assessment practicum, the 100 400 practicum in prescribing psychology, and then the 2-year conditional period. And then other brief update is we had previously passed a law allowing us now to administer injectable medications to our patients. It is about to be released from the licensing board, which there's a couple of snags with it, so there is a hold on implementation, but we hope it will be a very brief one. And then meanwhile, we had the first training for administering injectable medications earlier this spring, and about 20 of us completed that training. And we expect that training to be offered about every 1 to 2 years. So once again, congratulations everyone on the progress, and thank you, Beth, for your leadership in Illinois and nationally and the RXP movement. And I can't wait to see further developments of the way.
Thank you so much, George, and thank you for your leadership. And as you were talking about the progress that you've made in New Mexico, we're looking at each other and say, okay, we're going to have to do that here. So, we kind of push each other forward and provide and create opportunities for all of us. So thank you so much.